for responding heroically by getting vaccinated.
Whatever the anxieties we may have about the weeks and months ahead, particularly about Omicron and the growing numbers in hospitals, we can say one thing with certainty. Our position this December the 31st is incomparably better than last year.
Well, the front page of The Times reports that NHS bosses don't believe the threshold for any COVID restrictions in England has been crossed. Well, here with us now is Dr David Nicholl, speaking to us as a committee member of the Doctors Association UK. He's also a consultant neurologist based in Birmingham. Good morning to you.
Good morning.
How concerned are you as we sit here on New Year's Eve with no real restrictions in England at the moment, just recommendations that people take a lateral flow test, a test they might not be able to get hold of right now? Are you concerned about people going out tonight and celebrating and the potential for super spreader events?
Yes. I mean, I think we've collectively gone insane. And, you know, I was just looking at, I don't know if you've seen the front page of the Racing Post today, but it's talking about, you know, Cheltenham welcoming 30,000 people tomorrow, and I just think we've completely lost the plot. You know, I'm sorry to be just so cynical, but you know, upstairs I've got my son quarantining, and I live in Worcestershire, and I've got to drive him 52 miles to get a COVID test this afternoon, basically, and you know, I'm lucky because you know I'm well paid, middle class, and have a car. But my patients that live in Smethwick, I can't really exactly see them catching the bus to Shropshire to get a test. So I'm very worried about that. And you know, the vaccine program has been fantastic. You know, if you look at pockets of Birmingham, so you know, I work next to Handsworth, and I look at the figures. You know, just over around about half the population of Handsworth who could have a vaccine aren't vaccinated. So never mind boosters. There's a significant portion of our inner cities, particularly in the more deprived areas, where you've got multi-generation households and things. I'm really worried about that. Okay, so you know, on the one hand, it's good that we haven't yet seen the effect on ITU, but we are seeing effect on hospitalisations. I'm literally just looking at what's been happening overnight in my hospital, and you know, things are really, really stretched. So I think the idea of going out to some crowded New Year's Eve party is utterly bonkers. And actually, who's in charge?
When you look at the figures, there's a graph in the Times today which shows that of all of the hospital admissions, it doesn't appear to show, although there's a small section of don't know, it doesn't appear that anybody is in hospital having had a booster. Some people who are double vaccinated are, although we have been told, and we know this, don't we, that the double vaccination doesn't protect us against Omicron. You talk about people not being vaccinated in the area in which you work. The problem is, all of us staying in tonight for New Year's Eve is not going to protect those people who aren't vaccinated. What's going to protect those people who aren't vaccinated is getting a vaccine. And it's about how we go about that, isn't it?
I know, and in a way, I think I'm on the wrong radio station. You know, I think I should be on every Black, Asian, and radio station trying to get people on. And you know, it's a real issue. And if you look at those figures in those areas, they haven't actually changed very much in the last few months, basically. But you know, we are where we are, and Boris says it's completely fine. Go get a lateral flow, party like it's 1999. I mean, it's just insane.
When you speak to people who don't want to get vaccinated, what are they telling you? What's the reason? Because you're saying that that's not changing at all in recent months. And so many politicians who come on and talk to us say, what we need to do is talk to these people. It's not about making it mandatory. It's not about placing restrictions on unvaccinated people. It's about talking to them, engaging them, educating them, and ensuring that they make a choice, an informed choice, and they get the vaccine. But you're saying that message isn't getting through. So why not?
There's a lot of scepticism, okay? And, you know, I have my own personal story, and every member of one member of my immediate family wasn't vaccinated, died of COVID in July, okay? When I explained that in July, I was being accused of being a paid actor. So some of the stuff that's on social media is utterly vile, okay? And in fact, I've actually reported a broadcaster for spreading health misinformation to Ofcom. But there's such a range, okay? You know, there's a range from people who've got absolutely understandable concerns. So it's a neurologist, and, you know, often with any vaccine, people do get really, really anxious about neurological complications. Could that be related? And that produces a lot of anxiety. So just this week, in fact, I spoke to a patient who had transverse myelitis, so very serious condition, completely unrelated to the vaccine, but he delayed waiting to hear from me, and that actually it was okay and safe, basically. So having those conversations with people you trust is really, really important. I think there needs to be a much more serious, rigorous action taken against some of the anti-vaxxers. I'm very glad that Milton Keynes police are investigating some of the people that interrupt that swab centre, because I actually think that some of these more militant anti-vaxxers are a bigger threat, than ISIS is actually to UK citizens at the moment. Okay, and I've actually reported I saw information that was being shared in the Birmingham teachers WhatsApp group to counter terrorism. Okay, now that website's not there anymore, but information that would literally cause harm. That was false information that was being shared amongst Birmingham teachers, and the response from the headmaster of that teacher was to get the WhatsApp group deleted, not to take action against the individual that was sharing it.
You've talked about this collective insanity that people are going to be going out tonight. You worry about it being super spreader events in certain areas. What precautions do you think should be brought in England right now?
Well, and there are going to be people watching this who completely disagree with me, and my answer to that is, ask yourself, why is it that the English government, the Scottish government, the Welsh government, the Northern Irish government are all looking at the same data, yet only one of those is an outlier and has got a completely different response? So I think if you are going out, I would wear a decent mask. And certainly the Doctors Association, we've been campaigning. There's things which could happen now, okay? Wearing an FFP2 mask, I think is much better than a surgical mask. I mean, the irony is...
What is that mask? Explain that.
It's a higher quality grade mask, basically, okay? So rather than a standard surgical mask. We in the Doctors Association have been campaigning that, given the issues of staff sickness, which are very sizable at the moment, okay, why is it that we're not offering higher grade masks, particularly FFP3 masks, to all healthcare professionals, basically, given that, there's lots of things we don't know about Omicron, but the one thing we do know is it's much, much more transmissible. So wear a better mask.
But measures-wise, what is it that you think that how far would you go in placing restrictions in England?
Well, I don't think that's my job. Okay, I'm a neurologist, I'm not a public health doctor. Yeah. But I think that is the problem, actually, is that we're not following the science, okay? That's why I said, if you look at the different governments, they're offering different approaches. And I think the difficulty is that, sorry, this is a personal opinion rather than Doctors Association opinion, but if you just look at what's happening, Boris has got problems and he's having to address a particular part of his party, look at the Andrew Bridgens of this world, okay,
So you're talking about the political pressure from Conservative backbenchers, and you feel that Boris Johnson doesn't feel that he can act because of that. I want to ask you as well about Nightingale surge hubs, because we know there's going to be 8 of those across the country, one in your area, in Birmingham. Do you think that is the right approach? And also, I mean, beds are beds, but staff are another issue, aren't they? And you've already talked about the challenges with staff absences. Will there be enough people to actually staff this?
I don't know where you're going to get staff from. Really don't. And I feel like a witness rather than a victim. Okay, in the sense that when I go down and see my colleagues in critical care, I see people who are really burnt out. When I speak to my colleagues in critical care, I know that we have less ITU staff than we had 12 months ago in the West Midlands, and a large part of that is because people are burnt out. And if I think back a year ago, I can remember approaching people in my department who helped in the first wave and approached if they'd be willing to help out in search. And one of them in particular fell to pieces in front of me, just burst out crying. So please don't make me do that, Dr. Nichol. And another one went off sick for 3 weeks. So there's real issues of PTSD and stress amongst staff. So I think there'll be a sense of dread amongst large numbers of staff that we need to realise, basically. And, leads on to the whole issues of testing capacity and things like that. Frankly, much as I'm sure people are very keen to go out and party like it's 1999, I am more concerned that I have sufficient staff in my hospital to manage the wards for your sick relatives when you come in a couple of weeks' time.
You talk about testing capacity, and you've spoken about the fact you've got to drive over 50 miles to take your son to have a PCR test later on because there's no nearer ones. Do you think that NHS staff should be prioritised to get the tests that are available, whether that's lateral flow or PCR, to try and keep those members of staff within the healthcare system and working?
Yes, absolutely. And I think the biggest threat to the health infrastructure at the moment is actually staffing. We're not seeing that effect on ITU admissions at the moment. And if what I just said is true, that we've actually got less ITU staff, then clearly, staff should become priority over, having a party in Broad Street tonight.
We've been hearing on the Times from the president of the Royal College of Surgeons of Edinburgh, who has been speaking on the hemorrhaging of staff in the NHS and what to do to stop that, and said things like coffee shops and gyms and swimming pools at hospitals for NHS staff might encourage them not to leave. What do you make of that?
It's complicated. I mean, you could have we could be using up the rest of this show talking about things to help from car parking to sorting out pensions. Okay, but I think there's a lot of things that can be done. But equally, I have to say, in both of the trusts I work, I have been really, really impressed by management, busting a gut to do what they can to help people. But, when I just think, tonight in Birmingham, there's a whole range of New Year's Eve parties, yet at the same time, staff in the biggest hospital in Birmingham, which I can't name, okay, but you'll know what I'm talking about, aren't able to book annual leave in January because we're worried about being ready for the surge, basically. And who's your priority, really? A party or patients?
Dr. David Nicholl, thank you for your time today. Very grateful to you.
Thank you.
He is a committee member of the Doctors Association UK. Worth pointing out as well, we did ask the government to put a representative forward to speak to us on Times Radio Breakfast this morning, but no one was available.
The Times